The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm Don McIntosh, your host, and today we're joined by Dr. Kevin Bryant from Wichita, Kansas. Thank you, Dr. Bryant, for being here.
Good to be here.
One of the things you do as a family practice physician is deal with lots of people when they receive lab tests. And I understand you're involved in a program in the community that looks at really heart disease.
Right. I have the pleasure of being involved in a community outreach educational program called Coronary Health Improvement Project, dealing specifically with the risk factors that promote and cause heart disease.
How many people have you had go through that program thus far?
We have approximately 600 in our community have gone through.
And do you have any follow-up for them once they, how long is the program, and then do you have any follow-up?
The program lasts for 30 days. It's a pretty intensive program. And then on a monthly basis, we follow up, continuing to check their lipid levels, their blood cholesterol levels.
Cholesterol. Do you see big changes? Are people happy with that?
Dramatic changes can take place in 30 days. And it's rewarding to me as a physician to see people make those changes.
And how many times do you do that a year?
We do it about twice a year now.
Well, maybe some of the folks that are watching today don't have the privilege of being in a program like that. But let's say they've gone to the hospital or maybe seen their physician. They've heard a lot about cholesterol. Today, really, we're going to talk about how to tell the difference between good and bad cholesterol. And would it be fair to say that today it's going to be like they've just gotten their lab test back, and this would be a good time for them to maybe get out those numbers so that they could learn about how to look at those and find out what's happening?
Yeah, this program today is really designed to try and help people understand what the numbers mean when they get those reports back from their doctor.
Okay, so if you're watching today and you have some lab tests that you've had done, maybe cholesterol, run and get those tests. Turn up the set, you can hear what's happening, but go get those numbers, because I think you'll really find some things that can help you. One thing that it kind of intrigues me about the title of today's show, you're saying that there is good cholesterol and that there is bad cholesterol. I don't know which you want to talk about first, but what does that mean?
Well, yeah, I think a lot of people, their impression when they hear the word cholesterol, that it's bad. But there's actually good and bad cholesterol. We're going to try and explain that today. And the first thing that I find most people confused about is they get a report back and it has cholesterol on it, triglycerides, and many people are confused about even those terms, thinking that their triglycerides and cholesterol are the same thing, when in reality they're two completely separate chemical compounds in our body.
Okay.
And so you have to recognize there's cholesterol and then triglycerides. Cholesterol, if we had a lump of it here in your hand, is kind of a waxy substance, as where triglycerides is just a big name for oil or fat. And so your vegetable oils, your margarine, your butter, those are triglycerides. And because both the triglycerides and cholesterol are waxy or oily, they don't mix with water. Oil and water doesn't mix. Well, that's true in our body. Those substances, cholesterol and triglycerides, in the bloodstream would not mix.
Okay. So they're two different things, in other words.
Two different things, and because of the chemical structure, they don't mix with water in the serum in our blood. So our body, as a way to carry those two chemicals around in the bloodstream, produce protein molecules that carry the cholesterol.
So little trucks.
They're like little trucks in our
Okay.
bloodstream, if you want to think of them that way, that are carrying cholesterol and triglyceride around, because otherwise they would not mix in the bloodstream. So they're carried by those. And those protein molecules are divided into different categories.
Okay.
And as you can see here, they're divided roughly into three. Actually, there's, I think, 18 or 19 fractions.
But you're
or
just giving
different.
us the top.
We're
kind
giving
of,
us the three main ones that you're going to see on a lab result. First one is LDL, and we're going to talk in more detail about these. But LDL has become known as bad cholesterol,
lousy.
lousy
Okay.
density lipoprotein. And lipoprotein is the name for the protein. It just means lipo is fat and then protein. So it's the fat-protein combination.
Okay.
So LDL is considered bad because it tends to carry cholesterol to the wall of the artery.
Makes it fat, makes it
Makes it clogged up.
Clogged up,
That's the one that is kind of a culprit. And we'll look at that. The good cholesterol is called HDL. So when you look at a lab result, you want to look for LDL, bad, HDL is the good cholesterol.
happy.
Happy
All right.
density
Lousy
lipo.
and happy. All right, good.
And it does kind of the opposite. In a simplistic way, it's doing the opposite of the bad cholesterol. It's trying to take cholesterol out of the wall of the artery where these plaques are in the artery, and take them back to the liver.
So the lousy dumps it off in the artery. The happy says, no, I'm not happy with that, and takes it away.
And in a simplistic way, that's the way to look at it.
All right.
And then another one called VLDL is a protein that carries a lot of the triglycerides or fat around in the bloodstream.
Which are totally different than cholesterol, what you've told us.
Exactly, completely different. Now, if we look more specifically at the low-density lipoprotein, the LDL, what we call bad cholesterol, we talk about it carrying cholesterol around. Now, in essence, the cholesterol is the same cholesterol whether it's in an LDL or an HDL protein molecule, but it's the protein molecule that makes the difference, where that cholesterol is going. Is it going to the wall of the artery or out of the wall of the artery back to the liver to be disposed of?
And that protein molecule is LDL?
Is LDL or HDL.
Okay.
Now, as time has gone on and research has been done on this LDL molecule, we've discovered that by itself, pure cholesterol does not damage the wall of the artery or cause a problem. It's only when that cholesterol and that protein becomes oxidized by
Exposed to air?
either exposed to air in the animal products where the cholesterol may have been if you're eating animal products, or if sometimes in the body's metabolism, free radicals are produced that oxidize the cholesterol and the LDL protein. And when that happens, the body then begins to recognize this as actually as though it's a foreign body, almost like a bacteria, an enemy. And so part of the immune-fighting cells, particularly the ones called macrophages, actually begin to engulf those particles,
The LDL particles.
the LDL particles, in the wall of the artery in an attempt to, just like if it was an enemy.
Let me see if I have this straight. So LDL, the lousy
Density lipoprotein.
density lipoproteins, are those that have been exposed to air either outside the body, so foods would be like any dairy products or anything that have been exposed to air, or inside the body, that even happens inside your body without you doing anything. And so
So the point of this really is there are ways of trying to prevent that from taking place,
Okay.
because that's the important point. Just having the cholesterol, the LDL there, is not going to damage the wall of the artery until it becomes oxidized. So if we can prevent that oxidation from
On the
taking
outside.
place, either on the outside
Or on the inside.
either by not eating those animal products because they have oxidized cholesterol in them, which is going to be harmful to your vascular system, or, and this is where our what we call antioxidants, vitamins that are antioxidants are very important.
So antioxidation, anti what the air is doing.
Right.
Okay.
They, in other words, prevent that process from taking place. So even, we know that even if we have two different groups of people that have the same cholesterol levels, one group is eating those things that are high in antioxidants, which are fruits and vegetables. The other group is eating low. They don't have as many antioxidants. The group that is not eating the antioxidants in their food are going to be at greater risk for heart disease, even though their cholesterol levels are the same.
So they've got their lab sheet out at home, and they're looking at it, and it says my total cholesterol, let's say it says it's 200. That's not enough to look at. They've got to look at what does it say concerning LDL, what does it say concerning HDL. We've talked about the LDL. What's a good number for LDL?
Okay, right. LDL numbers, and this may be somewhat different from if you have your lab value there in front of you. The labs frequently put a reference number, what's normal,
and then
what's
a
abnormal.
star comes up if it's abnormal.
And we're finding now that if that number is below 90, that's the ideal range. There may be what's normal in America, but we want to be ideal, and so 90 or below is really the ideal range that we want to be in.
Now, usually on those normal sheets, what do they normally say? I mean, I know in your lipid area, what do they say as normal in your area?
Normally in America, below 130 is considered normal.
So that's quite a bit different than 90.
Right. We still find a lot of people with heart disease with the LDL numbers between 100 and 130.
So someone panic if their number says 120 or 30 today?
Not necessarily. I think that's a call to that person to find out, how do I lower that number? How do I get that down?
And I think you've mentioned sort of how to do that. Stay away from oxidized foods.
Well, right, because one of the main ways that LDL is raised in the bloodstream is by either eating cholesterol, animal products that have cholesterol, or foods that are high in fat, particularly what are called saturated fats. Primarily those fats that are found in animal products. They are what cause the body to produce more of this LDL protein to carry that cholesterol around.
We've been talking with Dr. Kevin Bryant. He is a doctor in family practice. He focuses on heart disease and helps people understand their lab tests and their values. We've talked about cholesterol, the bad type of cholesterol. And when we come back, we're going to look further at a good type of cholesterol, HDL. We hope that you join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, They present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Kevin Bryant from Wichita, Kansas. He's a specialist in family practice, and today we're talking about heart disease. And really what we've been talking about is lab tests, cholesterol. How can we tell whether or not we've had a good result or not? If you've just joined us and you've recently had a test, a lab test, and you know where it is, why don't you run and go get that lab test, have it there as you're listening to Dr. Bryant. On the first part of the program, we talked about low-density lipoprotein. Did I say that right?
You've got it down.
Lousy cholesterol, because what it does is it puts, you see if I'm right, I'm seeing if you're a good teacher, it puts that, the cholesterol right in the walls of our arteries and thickens them up, and that can cause real problems. So we don't want that to happen. And so we explained that, LDL, but now we want some good news. We've had the bad news, now we want some good. Do you have some good news for us today, Doctor?
Right. We have, obviously we've talked about the bad cholesterol. Now we want to look at the flip side, the good cholesterol. And again, it's the same cholesterol. It's just a different carrier truck that we've talked about. The protein molecule is different. So now the good cholesterol is carried by an HDL protein. So when you look at your lab result, the HDL is good cholesterol. Happy density lipoprotein is one way of looking at it. Now, the function that HDL has is opposite to the LDL. It's reversing, it's taking cholesterol out of that wall of the artery back to the heart. It's almost like there's this tug of war between these two protein molecules, bad cholesterol protein, LDL, putting it into the wall of the artery, HDL trying to take it back out. And so there's a balance here going on between the two. And that's why you want the bad cholesterol portion, the LDL, to be as low as possible. Mm-hmm. You want the good cholesterol to be high.
I see. So is there ever anyone that has a lab test where there's no LDL?
Where there's no LDL?
Right, zero.
No. You would probably be dead.
Okay, so you have to have some.
You have to have some.
So is there anything good about LDL then? We have to have some.
Well, actually, I mean, it is one of the carriers that carries cholesterol. All of our cells need cholesterol.
So the arteries of they need cholesterol, the actual wall, but the problem in America is they get too much.
They get too much.
Okay.
Right. It begins to clog the system up.
So we can kind of tip the scale as who's going to win this tug of war by what we eat or don't eat and all those different kinds
of things.
Right,
and now what we eat affects the LDL, the bad cholesterol.
Okay.
What affects the HDL and raises that, because we want more of that to take the cholesterol back out of the wall of the artery, try and open the arteries up. There's three main things that affect that.
Let us know those three things. What are the three things? Because we want to be happy, happy, happy.
Well, the first is our weight. If we're overweight, obesity lowers the HDL, decreases it. So as a person loses weight, over time, that will help the HDL level rise. And it doesn't happen overnight. It happens usually in several months, sometimes up to a year. As that weight's coming down, that the HDL number will go up. We find in this program that I'm involved with that in 30 days, the LDL, the bad cholesterol number, can come down dramatically. But it may take months to a year for the HDL level to rise.
Oh, so in other words, if the LDL's going down, you've started some good lifestyle things, you need to wait for the wait a while for the HDL.
Yeah, don't
Okay.
expect that one to change overnight. So weight is one issue. Smoking is another issue. Smoking also drives the HDL level
How
down.
does that work?
Not exactly sure how that connection is there. We've just seen that relationship that individuals smoking have lower HDL levels, and when they quit, over time that level rises again.
Okay.
So losing weight, stopping smoking, and then the third, probably one of the most powerful ways to raise HDL level is exercise.
Okay.
And it's really what we call dose-dependent relationship. The more you exercise, the more effect it has on raising the HDL level.
Let me ask you a question about that. Can you lose weight without exercising? Is it
You
just,
can
just
lose
by
weight.
caloric or by what you take in? You could lose weight that way. But so exercise really should be looked at as something different than losing weight. Is that what? I
Right.
mean, they may be related, but what you're saying is it's not enough to just lose weight by not eating as much food. You need to be out there, if possible, putting some pep in your step and spunk in your trunk and just moving it.
Yeah, the exercise is what's going to help you maintain that weight loss. And so, as well as
What if I
helping
can't
you
walk? What if I can't? What kind of exercise do I do then?
may be able to swim,
Okay,
cycle,
water aquatics or something like
right. Anything to raise that HDL.
that. So lose weight, stop smoking, and exercise.
Right. And the number that we're shooting for is above 40. Somewhere in the range of 40 or greater. In fact, the higher you can get that number, the better.
So let me just review a little bit. Maybe someone just was joining us. The LDL needs to be 90 or below. The HDL, if possible, needs to be 40 or
greater,
above.
Or above,
Okay.
right. Okay, now those are looking at the cholesterol issues.
Okay.
Now we're going to turn and focus on triglyceride.
Which you've said is different, completely different than cholesterol.
It's a different molecule.
Might be on the same
and-
sheet of paper, you're looking at your lab test, but it's different. Okay.
Right. And for a number of years, we weren't really sure if triglycerides really affected your risk for heart disease. We now know that it does. Now, triglycerides, again, are carried by what's called VLDL, another protein molecule that's carrying the triglycerides. So when you look at your lab test, you'll look down sometimes and see VLDL, and that's mainly carrying triglycerides. And also some of the cholesterol is carried in that, and we'll talk about that. But we know that if that value for the triglyceride levels is greater than 150, then the risk for heart disease begins to go up. And this is independent of what your cholesterol level is.
So wait a minute, the triglyceride level, if it's greater than 150,
Over 150,
there's problems.
the risk for heart disease begins to go up, irregardless of what your cholesterol level might be.
Okay. So just standing alone looking at it. You know, I've seen some tests, even my own lab tests, where the triglycerides one day seems to be real high, next day seems to be real low. Is it?
Well, and this is where how the blood is drawn is very important.
Okay.
To get an accurate measure of the triglyceride levels, you have to be fasting for at least 12 hours.
Oh, okay, I see. So
So-
if someone's looking at a lab test today and they just went in and got it drawn, they were in the emergency room or something, and they haven't been fasting, then it's really not even something to look at.
Right.
Okay.
You can't judge then. Now, there are a number of things that are involved in raising and lowering those triglyceride levels.
All right.
And our illustration goes through a number of the major determinants for triglyceride levels.
Okay.
Excess weight, again,
Get rid of the weight.
the weight raises triglyceride levels. Since triglycerides are fat molecules, it only stands to reason that if you have a high fat intake, you're going to have high fat levels in the bloodstream.
All right.
Stress is an interesting one. The higher the stress level, because of some of the hormones that are produced from the stress reaction, they stimulate the body to release fat and raises the fat levels in the bloodstream.
I see. And then the other ones were the same: lack of exercise, high fat intake,
Right.
and exercise, and then stress as well. So, yeah,
Right.
wow.
And sometimes diet areas, the high carbohydrate intake, high sugar intake, alcohol intake can raise the triglycerides. Now, we've talked about the bad cholesterol, good cholesterol, the triglyceride, the VLDL.
Okay.
If you add all of those up, LDL, HDL, and the VLDL,
All those numbers.
those numbers, VLDL has to be divided by 5. You add those all up,
All right.
and that'll give you your total cholesterol.
Okay, so I have let's say I have an LDL of 100, I have an HDL of 50, and then I have a
VLDL, say, of 200
Okay.
divided by 5 is 40. That'll give you your total cholesterol.
All right.
So your total cholesterol is carried in the blood by these different protein molecules.
That's what that number means.
Right.
It's LDL, HDL, VDL divided by 5, all added together.
Right.
All right.
And that total cholesterol number, really, even though some of the labs still report it as normal below 200, and when we look around the world, we find that populations that have total cholesterol levels below 150 on the average, we don't find heart disease, and so many of the researchers in this field are pushing for a lower total cholesterol level.
Doctor, we have 30 seconds. We've talked about, I want to give you 30 seconds for this little answer. We've talked about LDL, lousy. We've talked about how to get that out of your system. We've talked about HDL. We've talked about how that's happy. We want to elevate that. And what are some, just summarizing some things that people can do to have a good cholesterol?
Obviously, looking at diet. Diet's going to be the foundation,
Okay,
number
diet.
1.
What else?
Number 2 is going to be the exercise.
Exercise.
Number 3 is going to be looking at their weight,
And-
losing weight.
And then you said number
And
4?
Smoking
Smoking, and then maybe stress.
and stress.
Thank you so much for being with us, Dr. Bryant. We've been talking with Dr. Kevin Bryant from Wichita, Kansas. We've learned that there's good cholesterol. We've learned that there's bad cholesterol. We've learned how to really have a good cholesterol, what to do. We hope that what you've learned today will be a help to you, but not only you, maybe others that you know. And as a result of today's program, that you will have health that lasts for a lifetime.